about time.
Hello, I'm so sorry that it took me so long to get here. My name is Ida Baum. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Yes, I'm B. Zich, and my birth date is 9/23/69.
Okay, B. Can you tell me why you're here today?
Well, I haven't been feeling well. I keep waking up in the middle of the night and I have these night sweats and I can't sleep. It's horrible. I have to keep, I'm losing all kinds of sleep. Look at my eyes.
Okay.
It's awful.
I understand. What else is going on?
Well, I was at the country club the other day and I was there to play tennis. I had a, appointment with my tennis teacher and I got so lightheaded and I just don't feel well.
Okay. And then are you noticing any other symptoms besides not feeling well? Are there any pains, anything like that? Anything new that you haven't had before?
I've had this, been kind of swollen around this area here and, none of my jewelry is fitting properly.
Okay. All right, so I'm going to take a little look here. I'm just going to feel around, okay?
Oh, that
any pain
really
here?
is painful, yes.
Okay.
Be very gentle,
Sorry. Okay. Is it painful when I touch?
Obviously.
Okay. Now I'm going to take a little listen to your lungs, okay? And your heart.
Have you cleaned that thing?
What was that?
Have you cleaned that thing recently?
Absolutely. Can you take a deep breath for me? Okay, now sit still for me. Okay. So now, do you have any past medical history of heart disease, anything like that?
I'm healthy as an ox. I work out with my personal trainer all of the time. Recently though, I had a diagnosis of Epstein-Barr.
Okay. Anything else? Any other symptoms going on?
Well, my sister, she had some type of cancer, but I could never get anything like that.
Okay.
I'm way too busy.
So do you know what kind of cancer your sister had?
I think she said it was something about lymphoma.
Okay.
Something about that. I don't know. We don't spend very much time together.
Has anybody else in your family ever had any cancer or anything like that?
No, nothing.
Okay. So far you've told me you have night sweats.
Yes.
You've been urinating a lot at night.
Oh, definitely.
You're
I wake up and, I can't stop peeing.
Okay, you're feeling very fatigued.
Yes,
and you've
very
been sick
fatigued.
a lot lately?
Very sick. I just keep getting these viruses and I just don't know what's wrong.
Okay. It sounded to me like you had a little bit going on here. Do you feel like you've had a cough or anything like that?
Oh, it's been a very dry cough. It's been horrible.
Okay. And you're not taking any medications, any ACE inhibitors, anything like that?
Like I said, I have no problems.
Okay. Well, perfect. I'm going to take some vital signs on you, and then we'll get some labs and things going, and we'll figure out what's going on, okay?
Yes, can you please make sure and, speed things up here? I have an appointment I need to get to. I'm a very busy lady.
I understand. We're going to do everything we can, okay? Open your mouth for me, please. Okay, thank you. Oh, you're running a bit of a fever. Is that normal? Have you been experiencing
Well,
that?
how am I supposed to know that?
Okay, well, your temperature is 102.5. Okay, so I'm going to get you something for that, and I'm going to talk to the doctor. We're going to get some things ordered, and we're going to get this going, okay?
Great, this is just what I need.
Okay, I'll be back.
So next patient, Mrs. B. Zich. Sorry. So her signs and symptoms sound like Hodgkin's lymphoma. Family history of cancer, previous infection of Epstein-Barr. Guess she tested positive for having money.
Well, that would put her at a higher risk, so yes.
So she has some fatigue, the dry cough, night sweats, the previous infections, and her temp was 102.5?
Yes.
Okay, so unexplained weight loss. And how did her lymph nodes feel?
She had swollen lymph nodes in her subclavian and her inguinal.
Alrighty. So, some of the tests I want to run, I want to get a chest x-ray, CT, a CMC.
You mean a CBC?
That's exactly what I meant.
Mm-hmm.
CBC, CMP. Also, let's get a biopsy going to test for the Reed-Sternberg. I would also like to rule out non-Hodgkin's lymphoma.
Okay.
So let's do the lactate dehydrogenase and the beta-2 microglobulin.
Okay.
So And, you know, if those tests higher, you know what that means.
She's at poor prognosis.
Yes. Morning, I'm Dr. Ari Gaunt. You must be Mrs. B. Stitch.
It's B. B. Zitch. Get it straight.
Whatever. Anyway, so your test came back and it looks like you have cancer.
What?
Yeah. So,
What?
more specifically, Hodgkin's lymphoma.
Well, how do you know?
Well, your biopsy came back negative for Reed-Sternberg.
Didn't she
And-
mean positive for Reed-Sternberg, doctor?
That's exactly what I meant. Thank you. Your CAT scan showed that it is stage 3, and because your white blood cell count is so elevated, we have to start treatment as soon as possible.
Oh my gosh.
More specifically, chemo and radiation. This must be a difficult time for you. Someone let the nurse take it from here. I have other patients.
I've got this, doctor. I'm so sorry. Is there someone I can call for you?
I just don't know. I have to think about this for a moment.
Okay. I understand this is very difficult, and I'm gonna go and get some information on you, information for you, something about the treatments and different options. You know, 'cause there's so many options, and there's things we can do, and I know it's difficult right now. So I'm gonna get some information, and I'm gonna get the social worker, and we're gonna get through this. Okay?
Yeah, I just need a little time to gather my thoughts.
I understand. I understand completely. Are you sure there's no one I can call for?
No. I just need to be alone for a moment.
Okay. Let me get some things for you, some things to help you get through this, and I'll be back. All right?
Yes.
Okay.
Hello, B. I am Conda F. Down. I am the social worker here at the hospital. I understand that you've had some difficult news today. I would like to discuss with you some referrals. We will be referring you out to an oncologist in Linda, and I'm going to give you this information. We will be contacting you within the next couple of days to set up an appointment. I do want to discuss with you if you have any help at home.
Well, I just have my housekeeper, Alma, and my driver.
Okay, I will be looking into getting you some assistance at home. I also want to discuss with you any options as far as support groups. We do have a number of support groups to assist you that you may want to attend. This is also included in the paperwork that I've given you.
Hi, Dr. Gunn. Now, I know we're not going to be starting treatment here, but I'd love to give Mrs. Zitch some information on the medication she might be taking when she leaves and meets with her oncologist. Could you let me know what you think she might be ordered?
All right, well, the oncologist is probably going to order chemo, and the most common one is ABVD, and that's a 4-drug combo. Also, she's probably going to get the ISRT, involved site radiation therapy. So it's always best to combine those two treatments to make it effective.
Okay.
So just run along and let her know that.
Will do.
Actually, you're tested positive for your Epstein-Barr. Did I mess that up?
Hello, Miss Down. I am Miss. We have some options for you, and we can refer you out to some group that can help you at home. Send some.
All right. So what was wrong with this patient?
Oh, are we doing that?
Also like to get her down and get a biopsy to rule out non-Hodgkin's lymphoma and Hodgkin's, the Epstein-Barr test. Also, I would also like
Epstein-Barr test.
how they feel.
She had swollen lymph nodes on her right side here and her subclavian.
Okay, so these are the tests I want to run. I want to get a chest X-ray, a CT, a CBC, CMP. Also would like to get her biopsy to test for the Reed-Sternberg.
Yes. She had a swollen lymph node here in her under her subclavian.
Okay, so
I got that up. Sorry.
section of Epstein-Barr. Obviously, she comes from money. She's also tested positive for that. Fatigue.
I would like. I'm sorry. It's only medication she might be doing and not some information on it just to kind of give her a heads up so she knows. You can't say heads up. Okay.
No.
This is the end.